Good afternoon, everyone. We will now proceed with our COVID-19 update. Doctor, please proceed.
Good afternoon, everyone. I'm Dr. Jazz Atwal. I'm the Deputy Chief Provincial Public Health Officer for Manitoba. We are still very much in a transition throughout our province and in many sectors when it comes to COVID-19. Yesterday, proof of vaccination requirements were removed in public places. And on March 15th, mask requirements will also be removed. If the trends we are seeing continue to move in the right direction, there are two other changes to public health practice that I want to share today. Currently, there is a public health order in place that requires people who test positive for COVID-19 to self-isolate. On March 15th, this will also shift from a public health requirement to a public health recommendation. We'll be sharing further guidance on this in the coming days. No matter what your respiratory symptoms are, it's still recommended to stay home when you're sick, to give your body time to recover and to reduce the likelihood of spreading that illness to someone else. We are also planning to end COVID-19 case investigations on March 15th as well. So right now, when we receive a positive test result from the lab, we contact people to let them know, give them some guidance on how to care for themselves and their symptoms if they might be eligible for treatment as well. That work will continue because that's the standard of clinical care. We have to make sure that the person has access to their test results and information on what to do. But the change means we will no longer be conducting a case investigation, which focuses on finding out where they may have caught or transmitted COVID-19. And as we continue to transition to living with COVID-19 outside of public health restrictions, we also need to adjust to the information we collect and share with Manitobans. Real-time data is less critical with endemic reporting. Instead, we would shift our focus to key pieces of information that will provide the most relevant epidemiological evidence and data for both the public and for decision makers. Manitobans will see this shift in the days ahead as we focus on reporting on key trends, more vulnerable settings, and other important indicators of COVID activity and severity in our province. Information about COVID will continue to be transparent and publicly available, but this is a part of a response that has to shift as well. Finally, before we go to questions today, I wanted to provide another update on the distribution of rapid antigen tests. You'll remember that we recently changed our approach so asymptomatic people could pick up tests from our testing sites to keep at home and use if someone from their household developed symptoms. We also distributed thousands of tests to United Way Winnipeg. We are improving access this week in two new ways. First, another 18,000 tests will be available at all public library locations in Winnipeg. We are also partnering with retailers across the province to distribute another 4 million rapid tests to Manitobans. These retailers include Co-op, Loblaws, Shoppers Drug Mart, London Drugs, Rexall, Save on Foods, Sobeys, and Walmart. Some of these retailers may have supplies as early as today, but we expect supplies of rapid tests to be in place at all participating locations by early next week. We're in the process of signing on additional retail chains to enhance rapid test distribution as well. A full list of partners is on our website and will be updated on a regular basis. These tests are free of charge. No purchase is required at any of those retail locations. They're packaged in kits with 5 tests per kit, and each person can pick up 2 kits per visit to the retail location. More information, including when and how to use a rapid test, is available on our testing website. Our goal is to ensure these tests are readily available at all locations that are convenient to Manitobans. Thank you, and we can now go to questions.
Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Brandon Sun, Karen.
Good afternoon, Doctor. Thanks for taking our questions. Just to maybe elaborate more, because now you say, well, it's pretty obvious we're shifting to endemic. So can you maybe talk a little bit about some of the numbers that you say that are trending down and why we're shifting to endemic now?
Well, we have been reduce and mitigate the risks, not only for themselves, but for other Manitobans as well. So all the sacrifices we did, all the sacrifices Manitobans made in relation to masking, distancing, following the orders, messaging, testing, taking that vaccine, all enabled us to be in this position where as severe outcomes are diminished because of vaccine uptake, because of treatment options now available as well, we're able to alleviate a lot of or remove a lot of the orders that are in place in relation to mitigating COVID-19. And as we see, our severe outcomes are decreasing. So our ICU numbers are down, our hospitalizations are down, the number of cases being generated are down as well. And that was simply because also of the nature of Omicron and how many Manitobans ended up getting Omicron as well. So we're at a point where, the impact of COVID-19 is still there. It still will cause hospitalizations, still will cause some ICU admissions as well, and will still generate cases, but the impacts on severe outcomes is diminished. And it's where our system is managing those outcomes as well. And because of all those things, because case numbers are improving, we need to try to transition and continue our transition to managing COVID-19 like any other virus that impacts one's health.
Okay, thank you for that. And just on that, we're still in transition as we've been discussing for the last few weeks, but even Health Canada has said that there's probably going to be a slight bump in cases as health measures are believed across the country. So what, if any kind of a plan might be on the table in case there's another surge of COVID or there's another variant that proves to be quite aggressive?
So I think your question is multi-part there, right? So we are changing our management of this from an orders perspective. We do recognize there'll be greater interactions with people. So we'll see and we'll generate likely some more Omicron cases right now. Again, the impact on that from a hospitalization or severe outcome perspective is reduced compared to any other wave we've had. So we'll continue to see that. So I think we'll continue to see an up and down in relation to hospital admissions and ICU admissions and impacts on the healthcare system. I don't think we're going to see a new wave increase like we did previously in relation to that. Again, we'll have a plateau and continue to bump along. The system has been preparing and will continue to prepare for potentially another wave. And I think that's recognized that there might be another variant that comes along that might cause more severe outcomes. We don't know that at this point. There isn't anything that is on the horizon that we can see in relation to that, but we're going to continue to monitor that situation as well. So the system will continue to adjust and continue to expand its ability to manage illness in Manitoba from a clinical perspective. And on the public health side, we are diminishing what we're doing from a COVID-19 perspective, but we're also preparing, if need be, all the things we're already involved with to, if need be, to be able to ramp those up again. So that planning is underway and has been underway for a long period of time as well.
From CJOB, Skylar.
Hey, Dr. Atwal. I know for a long time, one of the, catchphrases of this pandemic from your public health office has been stay home when sick. And now it seems like we're kind of going away from that with these additional changes announced for March 15th. I know you're going away from a requirement to a recommendation, but what would you say to someone who has symptoms of COVID-19, maybe has tested negative on a rapid test, but still decides to, go to the grocery store or go to work?
Our messaging is still there. Like, if you are sick, stay at home and recover. Even before COVID-19, if one is sick, we weren't, from a clinical perspective, from a public health perspective, from a physician's perspective, from a healthcare perspective, we weren't saying go to work when you're sick and go do things when you're sick. That was never what we messaged, even before COVID. With COVID, that messaging was very strong. And we're going to continue to message that if you are sick, stay at home. If you are able or, qualify for treatment or at higher risk, make sure you get tested and access that treatment as well. So our messaging is still, if you are sick, stay at home. And if you qualify for a treatment because you're at higher risk, go get tested and seek treatment for your COVID-19 infection if you end up testing positive.
Okay, so I'm trying to understand why the change to this guideline would be made, that now you don't have to self-isolate if you are experiencing symptoms, because it seems to me like, of course that's the messaging, and it makes sense. It's common sense, and it always has been. Why wouldn't you just keep that in place?
Again, we're moving to more of an endemic state. We never had an order or a law in place in relation to any other infection per se prior to this as well, barring certain examples of it. And we need to kind of learn to, live with COVID and understand it is a part of our lives and is going to continue to be a part of our lives. And again, the messaging is there. We're going to continue to message regardless if it's COVID or not at any illness. Like, you shouldn't be out coughing in different locations. If you're sick, you should stay at home regardless of what is causing that illness until you recover from that illness.
From the Winnipeg Sun, James.
Good afternoon, Dr. Atwal. Do you have any idea about when the official vaccination campaign will end, and what vaccine delivery might look like in the future?
Well, we're continuing to look at our how we deliver vaccine, how we're going to deliver vaccine in the future. And we have a distributive model. We have some other smaller teams that are going up providing vaccine as well. I think that'll continue for the short term, and we're developing that strategy for the long term as well. And I think it'll continue to be somewhat how we see it today, but more focused on that distributive model. But again, once further information is finalized in that area, we will provide that to the public as well.
Great, that's it for me. Thank you.
From CBC Radio Canada, Anne Louise.
Good afternoon, doctors. Is it in the province plan to potentially recommend a fourth dose of vaccine, and if yes, when it would be available?
We continue to look at that evidence. When as that evidence evolves, we'll make determinations related to that as well. And we continue to follow what other partners are doing as well. And we look at our NACI recommendations as well. So again, when information is available, when something changes, we will provide that to the public.
Thank you. And what do you say to experts and doctors who say that the end of the vaccinal pass will make the health system even more precarious than it already was?
So, we know Omicron is already transmitting. Despite a lot of restrictions that were in place, we did see a lot of transmission of Omicron, and that was the nature of Omicron. It was much more infectious than any other variant out there. We have lots of vaccine uptake, in those 5+, 86.2% have gotten one dose, and those 18+, 89.6% have one dose. 87.7% of those 18+ have had two doses. We have lots of vaccine, there's lots of protection out there. So we do anticipate likely there'll be some increased transmission depending on how people interact, but it shouldn't cause significant impacts on the acute care system. It'll cause illness. There'll be some admissions related to that as well as what we anticipate, but we're going to continue to follow that as well. So as we've loosened restrictions, we're still looking at that data. We're going to continue to look at it on a regular basis as well. And, we're going to continue to monitor the situation. And if anything needs to change, we will provide that advice to people as well.
Thank you.
From CBC Manitoba, Peggy.
Hi, Dr. Atwal. So right now we understand there's still nurses from the Red Cross working at HSC. We know that the ICU number is still high compared to pre-COVID levels, and surgeries are still on hold. I guess my question is, how can these decisions be justified by public health when clearly the healthcare workers are still struggling to keep up? What message do you have to say to them?
We've had a challenging time with the pandemic. Our system prior to COVID on the acute care side was busy. It was strained at times as well. And the pandemic has caused greater strain in relation to impacts on the acute care system. First and foremost, I want to thank everyone involved in the acute care system for the sacrifices they've made to help patients out in whatever state or whatever need that was required. I want to thank all the patients out there, all Manitobans who've had to have delayed surgeries because of the pandemic, because of the issues related to capacity as well, that they've had those delays in their care as well. We need to understand that public health orders and measures have to be the least restrictive means. And we also have to understand that there are consequences to the orders that impact health as well. We're at a state here again where we're at a point because of what Manitobans have done, because of vaccine uptake, and now treatment availability, that we're able to be at this point where we're able to take those restrictions off Manitobans. That's not to say that the acute care system won't continue to be busy. They will continue to be busy, and I want to thank them again for that. The challenge here is we have to learn to live with COVID. It is a part of our lives, and we have to continue to lessen the impacts on the other determinants of health related to the measures that we put in place. And this is that process for that. Again, we're going to continue to monitor that situation as well and determine the impacts on the acute care system. And if with every change we've done, with every change we haven't done, we look at that and ascertain risk as well.
And so can you tell me a little bit more about those health consequences of the orders that you're talking about? What do you mean by that?
Well, when we restrict individuals from interacting with other people, when we restrict kids from interacting or engaging in activities, we could have impacts on mental health. We have seen impacts in mental health in relation to people's impacts in self-esteem, let's say, with mood symptoms, depression symptoms, anxiety symptoms as well. We've seen issues related to substance use, substance abuse as well. From children and the impacts of missing school, where for a lot of kids that was their safest place, where perhaps that was their one access point to having a safe environment for a period of time, having a meal given to them as well. That impacts health. Their social development of kids interacting with each other, that has an impact on health. Even for all the Manitobans who sacrificed and limited their social interactions, that has an impact on mental health. And people use different tools, different means, telephone, FaceTime. But there is something about that personal, physical interaction between people that's important. People's businesses, income have been impacted by this as well. So there's a number, and I'm not listing them all, but there are a number of things here that we have impacted on the health side that we recognize, and we need to, again, it was done with a purpose, with a need. And when that need isn't there, we have to look at lessening those impacts and removing the impacts in those areas as well.
Thank you.
From the Canadian Press, Brittany.
Good afternoon, Dr. Atwal. You mentioned that it will likely, or it's expected to see a slight increase in cases now that restrictions are lifted. Wondering though if there's anything from now until the 15th, when we're getting rid of masks, if anything, you guys will be looking at anything that numbers wise that could, push back that date even further.
Again, we look at all of our information that we receive, all the data that we receive, whether it's case generation, test positivity. We're more focused on the acute care system and the impacts on hospitalizations that are COVID related, ICU admissions that are COVID related. We take a look at all that information. And again, we've been able to lessen restrictions on Manitobans, and we still have seen that downward trend in cases. I think we'll continue to see that downward trend. We might have a bit of a plateau here in relation to the impacts on the acute care system, maybe even perhaps on the case generation, but that trend will continue where the impacts will be ongoing on an ongoing basis, lessened in each of those areas as well. So, we're going to continue to monitor that. Obviously, if there are substantive changes, we would adjust our response. But everything that we've done so far up to this point with the transitioning of removing orders, we're still seeing a reduction in case generation. We're seeing a reduction in severe outcomes. So I anticipate that to continue, though.
Okay, thank you. I know this has come up a lot, especially in the past week, with some organizations talking about how healthcare workers, the vaccine mandate should still be in place for healthcare workers. Wondering, when the conversations are going around about removing that, was it ever discussed to have healthcare vaccine mandates still apply to healthcare workers? And if so, like, what, I guess, was the reasoning behind including them?
So again, I think we're at a point here, we've had so much vaccine uptake. We're at a point here because of everything that Manitobans have done over the course of 2 years that we're able to remove orders. We're going to continue with that process. Again, we have to look at that risk of illness, risk of severe outcome, and that factors into all the decisions and the recommendations we make as well. And we'll continue to use that cycle of understanding the information and understanding the actual risk at the present time in relation to making those recommendations as well, whether it's vaccine related, whether it's messaging related or orders related as well.
From CTV Winnipeg, Michelle.
Hi, Dr. Atwal. Why make 4 million plus rapid tests available through grocery stores now? What was the decision process around that?
I think it was about accessibility to make rapid antigen tests accessible, more accessible, widely accessible. Again, we all through this process, there are, when people say we have X amount of supply, we have to manage that supply with the expectations and how we're going to utilize that supply. So on the testing side, when we first got rapid antigen tests, we had some supply constraints. So we focused on certain areas where we thought that would be most advantageous from a public health perspective. But as supply increases, we're able to distribute up much more widely. And again, so those things are taken into account. It's not just about having a test available. You have to understand how much of that supply is, how often does that supply comes in, and how best able to distribute it to individuals throughout the entire province as well.
So what's the benefit of having these given out to people in the community? I mean, if really the only benefit is like knowing that you have COVID because you don't have to self-isolate anymore. Just explain like what the benefit is for people to use these if they do get them.
So, I mean, the benefit there is, again, if one develops respiratory symptoms, to test yourself. If you test negative, you could test again in 24 hours and test again in, another 24 hours later to determine if you actually have COVID-19 or not. You should still, stay at home and still self-isolate, regardless if it's positive or negative, until your symptoms resolve. If it is positive for COVID-19, you want to spend the 5 days in self-isolation if you're fully vaccinated, and then wear a mask afterwards for another 5 days. But it also allows opportunity for those who might not have easily accessible testing to see, hey, I'm a higher risk individual. I did a home test. I had symptoms. I did a home test and I tested positive for COVID-19. And that allows them to access treatment in a more streamlined fashion, where they're able to connect in with a healthcare provider to look at that next step to access that treatment as well. So hopefully this turns into greater uptake of treatment and treatment amongst those individuals who can access it and are able to access it and to prevent those severe outcomes from happening as well.
From the Winnipeg Free Press, Katie.
Good afternoon, Dr. Atwal. What factors do you think play into the fact that uptake of third doses for adults is only at 54%? How much of that lag has to do with people waiting to get the booster because they've already been infected with COVID-19?
I don't have the specific numbers on what percentage of people over 18 are still waiting for their time to get the vaccine. I think that's some numbers that could be provided by the VITF. I think a lot of people have gotten that third dose. So, 18 plus, we're just over, 50 plus, we're just over 70%. So those are our highest risk individuals. People are still getting those third doses, especially when they are considered higher risk as well, when their time comes for it as well. The details of your questions, though, I think we could take that back and bring that to the VITF to give you some more specific numbers if we have in relation to how many people are waiting for the proper timeline to get their third dose as well.
Okay, thank you. And you've said that planning is underway in case we need to ramp things up again in terms of restrictions. Can you be more specific about what public health is planning if things do take a turn for the worse, if a new variant starts posing more risk? Will we see restrictions being reimposed, and how exactly will that happen once they've been removed?
So everything we've been involved with, from a messaging perspective, orders perspective, testing perspective, a vaccination perspective, a treatment perspective, an AIA perspective, we've sort of changed our approach in all those areas, and we're going to look at what could happen, and there's going to be different scenarios here. So it's hard to articulate all those different scenarios, but if something does come along that is potentially more severe, that has vaccine escape, what would our approach be? And we would be prepared for that. So we are preparing for a multitude of scenarios. And it's not only public health, this is about shared health as well. This is about the acute care system adjusting and planning for that as well. And planning is underway there as well. So again, everything we've been involved with, you could say that we are planning for everything that we've been involved with on, let's say, our ramp down and how we're interacting with those different areas right now and how we would ramp up or interact with those different areas in the future as well.
Thank you, Doctor. We have time for just a few more questions. Please proceed.
Yes, it's just about the vaccines. You were saying that we could look at some models for future distribution and long term. So I'm just thinking about what Dr. Reimert said earlier last month about this might be something we have to vaccinate ourselves against, like every year, like the flu. So are you actually preparing for a scenario like that?
For sure. So we're preparing for multitudes of scenarios in relation to, again, everything that we're doing as well. And again, it's really early to predict what would happen in the fall. It's really early, or we don't even know when that next wave might occur related to COVID-19. Again, if there's full vaccine escape, then in the future, then vaccines wouldn't be a part of that plan until a vaccine is developed for vaccine escape. If a variant develops where there is no vaccine escape and we have a large population that's vaccinated, what does that mean and how do we roll out, a vaccine for those individuals? Again, you could think of probably 100 different scenarios in relation to what might be happening or what might come down the road. And we're going to prepare for a multitude of those scenarios to look at how we would operationalize and mitigate risk here for Manitobans.
Mm-hmm.
Dr. Atwal, does this mean the end of MPI drive-through testing sites with the new rapid test program? Because I know we talked to MPI last week and it's had a big impact on their service times.
So I know the testing side, we're working on what that testing strategy looks like. And again, once more information is available on that, we will provide that to the public as well. Again, we're focusing on a test to treat approach as well. So that's very important to remember.
Okay, and I have one more about young children, specifically those in daycares, where an outbreak may be taking place or they are experiencing symptoms. I know some of them have been turned away from testing. And of course, those children are too young to be vaccinated. Just wondering why those children would be turned away.
So it just depends on what kind of test someone wants to access. We have to look at what the risk is for those in that age group for a severe outcome. again, if one is ill, stay at home until one is better and you can kind of get back to your regular activities. If testing is available, and even a rapid antigen test, depending on the age, depending on ability, then that can be utilized to determine if it is a COVID-19 infection or not. Regardless of that, one should still stay at home until one is better as well. And if it is COVID-19, we have to add in those extra days as well in relation to that. So again, we are working with all these sectors to look at what the risk is. I think where we're at in this pandemic, it's indemnizing basically. Our risk is mitigated right across the board for severe outcomes, especially in those who are younger and healthier, and those who aren't healthy. Again, we are working with those groups and care providers who take care of these individuals to help mitigate risk potentially even further, or to access treatment for those individuals as well.
Hi, Dr. Atwal. With the lifting of the isolation requirement, now businesses, public venues, potentially employers have a bigger burden to enforce the safety precaution, bearing potentially hostility from customers or employees who won't stay home. How do you respond to that?
So I think we've gone through a lot over the 2 years' time. I think there's a lot of messaging out there in relation to how to mitigate risk. I think, again, most Manitobans have done what's been asked. I think most Manitobans will continue to do what's asked of them as well. Yes, there are going to be those who might cause a bit of an issue in relation to whether it's messaging or at the present time even masking. I think we have to deal with those on a one-off basis as well. And there's tools and resources for employers to utilize in relation to that as well. And we could always assist. We have assisted employers in relation to messaging and managing certain situations as well. And we'll continue to be available to them as well.
Time for a couple more.
Dr. Atwal, just one more question on third doses. Has the province conducted public opinion research on third dose uptake? And if so, what did those polls show for expected uptake?
I'm not aware of that. And that's something we could take back to the VITF if that has or has not been done.
Thank you, Doctor. Thank you, everyone. This concludes our session.
Thank you.